I worked within the insurance industry most of my life before I started this company, and my specialty was that I designed and managed self-funded medical plans for large employers. And to do that, I helped them manage their cost and make sure that the care that they were giving was in financial ranges that were average for the country. Several years ago, I slowly went from feeling really great to feeling really lousy, and it was over an 18-month period of time. I retained fluids, I lost my energy, I felt lethargic, my thought processes were real fuzzy, my eyes weren't functioning well, and in general, I just felt like I was going downhill. Well, my doctor tried everything, and I had great health insurance, by the way, and I had access to care, so the care that I got was excellent. I was given a lot of drugs to help my symptoms, blood tests over and over again, but the result was that I, after 18 months, was losing my ability to work, and so it was financially hurting me because I couldn't earn a living. Out of frustration, I went to see an alternative medicine doctor that my girlfriend had recommended, and I walked in with a stack of papers, all of the test results that I'd had for 18 months, and wanted to give them to her, and she just kind of barely looked at them. And instead, she lifted up my chin and told me to stick out my tongue. In 30 seconds, the doctor that I went to see had told me what was wrong with me. I had a candida yeast infestation, which means that we all have this in our bodies, but mine had gotten out of control, and instead of attacking my female parts like it usually does, it had gotten systemic in my system, and so it was coming out in odd ways. The cure for this was to eat a lot of yogurt, to change my diet, to quit eating things that had sugar in them and flour. She gave me some herbs to help me intensify my immune system ability to respond. And in 2 weeks, I had lost 14 pounds of fluid and all of my symptoms were gone. This whole treatment process cost $500. The 18 months of treatment that I got previously, $15,000. I was in the insurance industry and I considered myself pretty good at getting claims processed. I could not get $1 of that treatment that worked paid for. And this is what created the big question in my mind: why? I'm going to point you all to this chart on the wall. The why ends up being in part because the lightest area of the pie chart, the physician area, and there's 633,000 physicians in the country as of 2006, have about 10,000 codes that they can use to bill for their services. The rest of the people or professions in that pie chart have about 200, which means that they don't have the tools that they need to say, here's what I did, pay me. Now that's profound. That's a profound and easy change to make to the healthcare system. Don't get me wrong, I'm not advocating alternative medicine over conventional medicine. I use conventional medicine too. I just happen to know that as an insurance expert, if you don't have a code, everything that goes on is invisible to the insurance industry. So what happens? We end up using physicians as gatekeepers to get to these other practitioners. It's not that they're not there, but it costs more to use a physician as a gatekeeper, and in most instances, these practitioners are qualified to manage patient care without oversight, similar to what Christine was saying. So let's think out the box here. How do you get the population to access 2 million more practitioners without upsetting the apple cart? And the answer that we came up with was first to develop a set of codes to describe the care that they provided and to put financial resource indicators on those codes so that they could negotiate their fees with the insurance industry the same way doctors did. But that wasn't enough to solve the problem. There's this law called the Health Insurance Portability and Accountability Act that has a fraud and abuse provision in it whereby any practitioner who files a false claim to an insurance company and the insurance company who pays that can both be fined $10,000 per claim. That's very meaningful when you think that $11 billion have been collected by the federal government since 2000 for such fines. So it was also important, if we were going to provide access to these other practitioners within insurance reimbursement, to also quantify who was allowed to do what in which state. My company is monitoring over 18 million units of references to state statutes, administrative regulations, case law, and training standards, so that you can automate the process as a claim is filed to verify that the practitioner giving the treatment is allowed to give the treatment, and thereby helping both sides of the equation avoid that $10,000 per claim fine. Everyone on the Hill has been talking about using information technology as a really good way to save money in the healthcare industry and to increase quality. The problem is, if you don't have codes for computers to read, you're only increasing information about the practitioners whose services are coded. As our nation's population ages, we need to measure all treatment patterns that are going on, and we need to define when to provide care for what cause, for what group. Technology can help do that as long as you input the information, and that's what we're trying to do. How long is this going to take? Well, if the press gets involved, not long. I challenge the press today to ask all of the people on the Hill and the presidential candidates if they understand that if they open up access to non-physicians, how much that can do immediately to solve the healthcare problems in this country. As I don't know if it's 80% or 85%, but a huge amount of the care that goes on is not critical care. We need the limited number of doctors that we have to focus on critical medical care, because they need to be there. That's where the care is falling down. They can't keep managing non-critical care. We don't have enough of them. If we don't change the way that we access healthcare practitioners in the country, I don't care what party wins, if we have universal coverage or if we have private insurance, you and I are going to be waiting longer and longer hours to see our doctors to get a prescription, when instead, within minutes, we could be seeing a non-physician and getting our healthcare issues taken care of in a way that we don't even know exists until we have the data. Please remember this pie chart. I have a handout for everyone that came today that has that in there. Please remember the pie chart, because it shows what the problem is very graphically. And I know that the problem is solvable. We can provide greater access to more care at less cost today. Thanks.